Hello, we're so glad that you joined us for this broadcast. My name is Dr. Amy Thompson, and I'm the CEO of Covenant Children's Hospital in Lubbock, Texas. Before we get started, I just want to remind everyone the information provided in this event is for informational purposes only. For any specific medical questions that you have, please reach out to your primary health provider or other healthcare professionals. So just want to make sure everybody remembers that. I'm super excited today, so I'm excited to welcome Dr. Laura Johnson. And so she is a pediatric hospitalist, and she is a professor at Texas Tech University Health Sciences Center. She also serves as the division chief for inpatient pediatric medicine at Texas Tech. And what I will tell you guys is the reason I'm so excited is this is the physician. I'm also a pediatric hospitalist, and I will tell you I both chose pediatrics and specifically chose pediatric hospital medicine as Dr. Johnson was my mentor. And so I'm so grateful that she's on today. She still is active and practicing. She still allows me to cover a few shifts every month as a hospitalist. So we'll be talking to you today. While my primary job is CEO, I actually work for Dr. Johnson whenever I'm on service with Texas Tech. So Dr. Johnson, we're so glad that you're with us today. So thank you so much for being with us.
Thanks so much for having me.
Okay, awesome. Well, I just want to start off a conversation just about kids and COVID and kind of where we are at. We had one of these, at the beginning of the pandemic with, some folks. And so now here we are, still in it. So just wanted to make sure that we follow up on some of the questions. So first, I've talked a little bit about you, but tell us a little bit about what you do at Covenant, and then just start to talk to me about, what is your intro to special precautions or different other things that are happening because of children and COVID?
Sure. So as you said, I'm a pediatric hospitalist, and our hospitalist team here at Covenant Children's takes care of almost all of our medical inpatients, patients who come into the hospital for medical rather than surgical reasons. And then we also help our surgical colleagues take care of some of those patients with surgical needs. So we're intimately involved in caring for a lot of our patients here at Covenant Children's. In terms of children and COVID, I guess I would start just everything we do in the hospital has been changed, of course, since the COVID pandemic began. And we've been working across our region and of course within the system to make sure that the needs of children are first and foremost for our children's hospital in terms of continuing to provide great care for our kids while also dealing with the pressures of COVID. So that that can range from making sure that we're providing community outreach for vaccination opportunities, making sure that we're providing the best care for patients who find themselves needing hospitalization because of COVID, providing testing in our outpatient sites, and then for things like scheduled surgeries or scheduled procedures, we've changed how we do so much of that in order to make sure that we're screening patients for possible asymptomatic COVID before they're undergoing procedures. So I think, and as you know, Dr. Thompson is the CEO, we've had to change a lot and had to modify the way we do things in order to continue to provide great care in the current environment.
Yeah, I agree. And I think we started off with, right or wrong. I think we kind of started off as like, oh my gosh, there's this COVID thing and it's kind of over here and we have to figure out, how to care for it over here. And what I would tell folks is, from the last time that I did this COVID talk till now, COVID is with us and it has stayed with us, I think, longer than, anyone probably anticipated. And so we have had to change a lot of things to just understand that COVID, like influenza, like RSV, like things for us that are just part of what it means to take care of kids, that we've had to learn how to just implement that into our hospital. So next question that I hear a lot of people asking are, talk to me about the difference between COVID in adults and COVID in kids.
Yeah. So you brought up flu, and one of the things that's certainly true for flu is that illnesses in young children tend to be more severe, and we worry a lot about, for example, pediatric flu severity. We are lucky that COVID, from a pediatric standpoint, is not as severe in kids as it is in adults. So certainly we've cared for many children who are very sick, and certainly there have been pediatric COVID deaths and things like that. So I don't want to minimize it at all, but it is true that that in general the symptoms are more mild, and kids are more likely to have asymptomatic infections also. When kids do become sick with COVID, however, they tend to have many of the same symptoms that we hear about for adults. So fever, headache, cough, respiratory concerns, sore throat, body aches, potentially loss of taste and smell. All of those kinds of symptoms that we hear about with adults, they're really similar in kids. And that can make it difficult too, when you're trying to determine, say, at home or at school or in various community settings, if a kid does have COVID, because those symptoms are pretty nonspecific and can go with a whole lot of things. And that's one of the reasons why testing can be really important as well, to make sure that we're finding those cases of COVID when they're happening.
Great. Thank you. I want to turn just a little bit and say, we'll come back in a minute to some COVID in the hospital, kind of things, which is what you and I do. But let's turn a little bit of the focus to some of the other things that happen as a result of COVID. And so we've seen this in the adult population as well, but and I can speak to this a little bit from the CEO perspective in terms of what we've seen in our ED, but talk to me about mental health. Like, what kind of things have you seen, and do we know as pediatricians that are happening to children in kind of that behavioral mental health space?
Yeah, I think that just can't be overemphasized, the extent to which children have had significant mental health impact. So we see it. There's some reports looking at suicide rates. We certainly have seen it in terms of inpatient volumes of patients having to come into the emergency department because of mental health crises. But I think it's also important that we see it sort of, throughout the community. So the mental health impacts have been really significant, and that is, due to a lot of different things. It's due to the fact that everyone's world has been turned upside down. For many of our children, they were out of a school environment for an extended period of time. Their opportunities to engage with their friends and their peers in a normal developmental way have been really limited. They may have had limitations in terms of, accessing resources and getting help, something as simple as going to the school counselor when things aren't going well. All of those things have been disrupted because of COVID and because of the pandemic. And so, while I'm not a mental health expert, we certainly engage in helping to care for our children with mental health needs quite a bit. And I think it's going to be years before we see the resolution of the impact of the pandemic from a children's mental health standpoint. It's going to take us quite a while to recover from the challenges that our children have faced. And then, I think it's not just our children, it's everyone in the family. So when adults are sick, or when there are economic issues that are related to the pandemic, or just when things are changing too much and too uncertain, all of those things can cause mental health challenges for all of us.
Yes, I agree with all of that. And I will say, from a CEO perspective at a children's hospital, we have certainly seen the thing that Dr. Johnson talks about, which is increased number of patients coming to our ED. Actually, one of the biggest things that we've seen is actually increased need for actual placement in a behavioral health facility beyond our emergency room. So not just coming to get some treatment maybe in the outpatient setting, which has also gone up, but even the need for those acute, inpatient beds. And I talk about, I had a COVID senior, is what I call them. So I had a son, he was a senior in high school, kind of that when COVID really first hit. And man, it was hard. It was hard on all the kids, but I think especially what I lived through was the senior thing where they missed, all of these milestones that they were supposed to have, prom and, just all of these things that they did, graduation. I mean, all the stuff that you think about that they didn't get to do. And then really what happened is all of those seniors turned around and became COVID freshmen. And my son went away to college, for the first semester, and no exaggeration, at one point had spent 59 days in isolation in his room because of either exposure or, different things. And what I will say is I've even lived that personally in my house. I have a younger son who's 12, and he really struggled with at-home learning. And so if you're out there and you're a parent, the thing that Dr. Johnson is talking about, and what I would say is even as a parent, this is stuff that your kids, it's affecting, how it is that they are interacting with stuff that has been so normal for them. So just continue to have those conversations and make sure that there's not intervention that we need to do. I think most schools are at least back in some capacity, in person, and hopefully they're taking precautions, but I think this is a real thing. Okay, we're going to switch gears again.
Hey.
So now let's go all things vaccination. So this is, I always joke, I'm a big, I should wear a t-shirt that says, pro-vaccine in all things. So let's turn to some of the questions, because I know there's a lot of questions about vaccination. And so my question is, when you think about, the Pfizer vaccine, because the Pfizer is the one that has been, for 12 and up, what do you think it's going to mean, and when do you think we can expect even potentially a decrease on the age from 12 until lower?
Yeah, that's a great question. So Pfizer came out earlier this week, I believe, with some updated data regarding safety and efficacy in children 5 to 11. And so I think that has just provided even more questions about timing, about when we're going to see this vaccine authorized in those younger age groups. And I don't know the answer to that. Certainly the fact that Pfizer released the data means that from their perspective, they've concluded the necessary study phase to bring those data to the FDA. And that's kind of where we are right now. I would anticipate that process will go fairly quickly, but I think what's important is, the FDA will go through their process, and then the CDC, the Advisory Committee on Immunization Practices, will go through their process as they always do with any vaccine. And so while I think it looks like it's probably going to be authorized for younger children soon, I think we don't actually know that, and we don't know exactly what that's going to look like. And that's actually a good thing, because we want these multiple layers of review and careful scientific assessment to be happening for our vaccines. So as hard as it is to be patient, we want to continue to be patient for those younger kids. But we also know for our kids 12 and up, we do have a vaccine available. And we know that a lot of kids haven't been vaccinated. So I think, the most important thing we can do right now is to wait to hear from the FDA and the CDC, but to make sure that everybody over 12 is getting vaccinated.
Boy, yes. Now, the question that my 19-year-old son asked me, who's now 20, but was 19 when he asked me the question, that I think a lot of parents have this question and their kids are asking this question is, but mom or dad or whoever takes care of me, I have had COVID. And so doesn't that mean I don't have to get the vaccine?
Yeah, so that is a commonly asked question. And the answer is not really. It doesn't mean that you shouldn't get the vaccine. So we know that having had COVID will provide some protection and absolutely provide some immunity. But we still don't know how long that immunity lasts. And certainly what we've seen with the Delta wave is that there's a lot of breakthrough infection, even in people who have been vaccinated. But the more layers of protection we can have, the better. So it's absolutely recommended that even if you have COVID, certainly once you've recovered, you shouldn't get vaccinated when you're in the midst of acute COVID. But once you've recovered, you should be vaccinated. If, and this doesn't happen very often in children, but if you were treated with monoclonal antibodies, then there is a waiting period after that. So always, talk to your physician or vaccine provider about that timing. But still, having had the vaccine doesn't get you out of. Having had the illness doesn't get you out of getting vaccinated. I have an 11-year-old who unfortunately just recently has had COVID. And that was the first question out of her mouth, that surely this would mean that she would not have to get the vaccine. Of course, she's not eligible just yet, but I suspect that will change soon, and then we'll certainly be in line for her to get her vaccine.
I told my son we'd talk about it on the way to get the shot, the answer to his question.
Right.
And I'll just take this opportunity, for those of you who are on the camera, you're seeing me suck on a cough drop here. And what I would say is I'm shocked that I haven't still coughed. I am an example of someone who had both vaccinations. So I was fully vaccinated. I was one of the first people to get vaccinated at our hospital, simply because wanting to show that I felt like it was safe. And I got a breakthrough case of COVID during this Delta variant. And what I will tell you is I was sick, not sick enough like I need to go to the hospital, but certainly like in the category of, I typically don't miss a lot of days of work because of illness and things like this. And I certainly was down, in my house just with a lot of symptoms, and have had the cough clearly that can never go away. But I just want to take this opportunity. I know we're talking about kids, but Dr. Johnson just kind of brought up Delta variant and some breakthrough cases, and I'm an example of that. And the data right now is overwhelming that patients in the hospital, especially in the adult population, are unvaccinated. And I have heard, some of these other things about, if you're going to get it, even if you're vaccinated. And what I would say is I wasn't in the hospital, and I certainly wasn't on a ventilator, and, things like that. So just to throw that out there and explain, why I'm still sucking on a cough drop. So you also are going to have some questions from parents on things like allergies. And I think that that's a legit question about immunizations that folks always have. So talk about potentially maybe allergies, and should they be concerned about that with the COVID vaccine?
Yeah, early on when we first started vaccinating back in December, outside of the trial setting, there was some concern about allergic reactions, and of course we were monitoring things very carefully at that time. And I think some of those initial reports and maybe media reports about some allergic reactions probably have created more concern about that. But in general, it's really not something we need to worry about. We still, even with the history of having food allergies or other sorts of allergies, we still recommend the COVID vaccine, and the data show that it's still a safe thing to do. So certainly understand that there may be concerns about allergies, and certainly it's always appropriate to talk to your pediatrician or other healthcare provider regarding that. But overall, the recommendation is that allergies are not a reason to worry or to put off the COVID vaccine.
Now I know you're not an OB, so you're going to love, the fact that I'm going to throw an OB question. I'll add something at the end because I am the CEO of a hospital that delivers babies, so we have a lot of pregnant women. But one of the other things, and I think this is a question that folks with young girls are having, is talk to me about any of the information that has to do with COVID-19 vaccine and this fertility question.
Yeah, and that's something that a lot of people have asked, and for reasons that I'm not entirely sure, that has been a concern that has been, very prominent. Is there an impact on fertility? And so, the American College of Obstetricians and Gynecologists and other related groups of specialists in fertility and in maternal and fetal medicine have all come out with a statement saying both that the COVID vaccine should be given to women, made available to women when they're pregnant, but also that there's absolutely no evidence to suggest that there's any impact on fertility. The vaccine has been given to millions and millions of people, and there haven't been any reports of concerns about fertility. And then, in addition, there's no real scientific plausibility to why, to think that there would be an impact on fertility because of the way that the vaccines work. So I know that that's a concern, and I certainly understand that people are always going to be concerned about possible side effects, which is understandable, but there really is just no evidence to support a concern around fertility.
And I think I agree with that. And I recently did a press conference here in town where that was one of the questions that was asked. And I stated a lot of the things that you said, that there's a really strong statement. Like when places that are, professional organizations come out with these really strong statements, like they really mean it, that there's no evidence and there's no founding for the concern, about infertility. And those are, for those of us in the medical community, those are the societies that govern, the kind of medicine. And so I have a lot of confidence in the American Academy of Pediatrics, in ACOG, which is the group, for OB-GYNs. And so those are the groups that are coming out that are looking at the data, that are making those recommendations. We have seen a lot of pregnant women who have been positive for COVID during this pandemic, and most of those are asymptomatic. We have certainly had a few who we have had to transfer, to adult services, with severe, like what I call respiratory COVID. There is data to show that women who get COVID do have a higher incidence of preterm labor. And so and then for women who get sick, there's also some data to suggest that those women could actually potentially have worse, cases of respiratory, illness. So that is some of the data, that's out there when we look at this pandemic that we can, kind of talk about. Okay, so I'm a mom and I'm at home and I've got young children. And when I talk about young children, it kind of goes back to that thing that we, can't really vaccinate less than 12. So if you're talking to a mom at home or a caregiver, a dad, anyone who's taking care, how can they best protect their young children and even other family members for COVID?
Yeah, the most important thing you can do to protect your family is to make sure everyone who can get vaccinated does get vaccinated. So that may sound simple, but that's a way to cocoon those people in your family who may have immunocompromise or who are too young to be eligible for the vaccine. If everyone around them is vaccinated, it makes it much harder for them to catch COVID, just because they have this layer of protection around them with those vaccinated individuals. Beyond that, beyond vaccinating everyone in the family who's eligible, the other things are just those straightforward, maybe common sense parent things that we do in terms of making sure if people are around, if you're interacting with others in your community, that you're all sharing if anyone's sick, and that you're not spending time together if someone is sick. You want to make sure that you're practicing good hand washing, and just trying to be vigilant for any sort of illness or other symptoms that might be going on. And that is how we not only prevent COVID, but that's also how we decrease transmission of other viruses like RSV.
Yes, I agree. I agree with that as well. The other thing that I would say is I lived in a household where my husband is actually the first one who became symptomatic with COVID. As soon as we found out that he had symptoms that could have been COVID, we, even in the house, we immediately separated, put in a different bedroom. I joked that I was shoving the tray of food, across the floor. I said we were only going to eat together if we ate outside at these really far away, tables. But then when I started having symptoms, the day that I started having symptoms that ultimately would be this breakthrough case of COVID, we had started, once my husband had this, to separate all of us in the house. And to make sure that we were doing all of the precautions that we needed to do that. So if a parent is asking you, Dr. Johnson, so if I have these symptoms that you've talked about, or my kid has these symptoms, what is the very next thing that they should do?
So, I think it's really important, of course, if you're uncertain, you always want to call your doctor. So that's always the first step and the first answer. But it's also true that you may have some symptoms that maybe you're not concerned about the symptoms themselves. Maybe they're fairly mild, but you're worried, could this be COVID? And so, every community is different, but we're lucky to have a lot of testing resources and a lot of availability of testing. There are even at-home tests that you can find available in many of our pharmacies and other places in your community. And one of the things that the federal government has done recently is tried to increase the availability and decrease the cost of some of those at-home tests as well. So there are caveats about the at-home tests, and that they're not perfect, they're not perfectly accurate, but they may be a helpful way to have a little bit of peace of mind and get a quick answer at least, while you maybe are waiting to get a more definitive answer with a more precise and more accurate PCR test. Those rapid tests that many healthcare facilities have, but that you can also have some versions at home, you'll have an answer in about 15 to 20 minutes. And so that can be really helpful if you're, trying to make a quick decision about whether somebody's going to get sent to the other side of the house, or whether somebody's going to, need to stop everything and get a test right away, those kinds of things. But then the most accurate test, and certainly the kind of test we want to use if we're screening, meaning if we have someone who doesn't have symptoms, but we really need to know if they have COVID for whatever reason, before a procedure, before having a baby, before travel, some of those things, those are the PCR tests that are also fairly readily available. So certainly all of our hospitals and clinics in the health system should have access to those tests. And it's a little bit different in each community how to get a test. So it's hard to give a blanket answer, but there are certainly online resources to help you find a test near you. Most of the large pharmacies also have some degree of testing availability. So sometimes I wish it were a little bit easier. I think I've certainly had friends and family who've had, have wanted a test and then have sort of stumbled with how to get one. But my advice would be start with your doctor, find out if you can get a test there, but then also some quick Googling may really help you find the resources where you can be tested.
Yep, I agree. And we struggled a little bit to find, a place where I could get my son tested whenever, we, came down with the breakthrough COVID. But to your point, what we did is call the PCP, and we're able to do so. We've also had some other changes in the hospital just in relation, to COVID. And this because we've been on service, and actually I was on a few weekends ago and provided coverage for the COVID patients, as well as, a few others. But it has really affected children's hospitals here lately more like it has been doing for a long time in the adult hospital. And so, I can't think of the last time that we have been where we're not worried about PICU beds. A lot of these patients, for us, intermediate care and PICU, are in the same place. And so talk about some of your experiences just with, we've talked about COVID and we've talked about, some of those patients in the hospital, but what are some of the other consequences that we're seeing as a result of the large number of COVID patients that we have?
Sure. When hospitals are overwhelmed with COVID patients, there's a lot of downstream effects. And we've talked about that, as you said, a lot in the adult space, but we are really feeling that in the children's world now, probably because we're having both COVID and RSV surging simultaneously, which has really had a significant impact in our region here in Texas on PICU bed availability and children's hospital beds. That may mean that your planned surgery for your child for an orthopedic or or other indication is going to have to be delayed because there may not be enough staff to even do an outpatient surgery in some instances. That may mean that your referral for a subspecialist may be delayed. And that may mean that the care that you would otherwise be able to receive in a more timely manner may have to occur in a different way. And it really can have a lot of trickle-down impacts, even if you don't ever have a close brush with actual COVID disease. And I think that's one of the reasons why we talk about, this is a community issue and it's a community responsibility. So we all need to be doing what we can to decrease COVID transmission, to be vaccinated, to follow guidance, and try to get ahead and beyond this wave of COVID, because it's best for everyone, and everyone's health may be impacted, even if it's not directly through COVID.
Yep. I'm a West Texas girl, as you know, and so we've had, I have family that lives all over, West Texas, and we had a family member recently that was having symptoms of a stroke, was in an outside facility, and we were unable to get them in to Lubbock. And that wasn't because, people were unwilling or those kind of things. It's because we legit did not have beds, at the adult hospital. And I think the thing that's different for me in this wave of COVID is that we're now feeling that in pediatrics. And so when I look at, data like the number of PICU beds available, that used to not be an issue. And now certainly, those things are in. And so to your point, you just have this major, trickle down effect that because the hospitals are so full, of COVID patients, that sometimes we're having to turn, folks away. Knock on wood, we haven't had to do that yet in the Peds hospital. But we certainly have had to postpone some surgeries. And I always kind of make the argument in kids, there's very few surgeries that are actually elective. So, we don't want to have to postpone those. Okay, so we have only a few minutes left, Dr. Johnson, and I want to say thank you for joining us, but I'm just going to give you the floor for the last, minute or so, just to say, anything that you want to. I'm going to say something first, and that's because I hope that if you have listened in on this today, please talk to providers and folks that are knowledgeable about the vaccine. I'm a person who firmly believes in the vaccine. I have this weird other part that I have a master's in cell biology. So I also have this, this mRNA technology, I think, is fantastic. I think we're going to look back on this as a big, I think it's going to have more impacts than just on, COVID-19 vaccines. But if you have questions about getting the vaccine, because I agree with Dr. Johnson, that is really the best way that we're going to protect our kids. And this was my closing statement on the press conference I did last week, is the very best way that we can protect our kids is to do the stuff we know to do. Mask, social distance, wash your hands, all the things. But it's for all the adults and the folks that are eligible for the vaccine to get vaccinated. So with that, I'm going to let you, Dr. Johnson, take it home and tell us anything else that's on your mind about COVID.
Yeah, I think I would just say that we've seen a lot of good things for kids with this pandemic. And what I mean by that is I'm thankful every day that this respiratory virus is not as dangerous for children as we might have predicted it would be, because so many respiratory viruses are very dangerous for children, especially young children. But I also think that, unfortunately, that our children have really borne a lot of the impact of the pandemic. And we talked about the mental health impacts, and we've talked about how things have been disrupted. And I think even just the amount of discord that we have in our society about the pandemic and about some of the things that we've talked about today. So I think we all need to remind ourselves that as a pediatrician, but I think also just as a member of our society, our children should come first, and we want to do everything we can to try to take care of them and keep them safe, but also keep them happy and healthy in all ways.
I agree. Thank you so much for being with us today. I'm so grateful.
Thank you so much. Thank you.